Examining all of this evidence, we found pervasive interpersonal systemic racism.
When it comes to BC's healthcare system, racism against Indigenous peoples is everywhere. That from a first-of-its-kind report commissioned by the BC government. The investigation began last June after reports staff at a BC hospital were playing a game to guess the blood alcohol level of Indigenous patients. The inquiry, led by former judge and children's advocate Mary Ellen Turpel-Lafond, found that game was just the tip of the iceberg. In fact, there's racism against Indigenous people at all points of care in BC.
Among the top negative assumptions that are circulating in our healthcare system today is the idea that Indigenous patients and people are less worthy, that they're alcoholics, that they're drug seeking, that we're bad parents, frequent flyers, non-compliant, and incapable of adhering to treatment and medical advice.
After hearing hundreds of personal, traumatic stories of prejudice and extensive consultation with community groups, Turpel-Lafond has released a 200-page report titled In Plain Sight. It makes 24 recommendations.
Taken together, I believe they create a blueprint for rooting out racism and discrimination.
The recommendations include creating the role of a BC Indigenous Health Officer, launching a School of Indigenous Medicine at UBC, and encouraging people to speak up when they see racism in the healthcare system. BC Friendship Centres are already on it, launching a tool to anonymously report concerns online.
To show the healthcare system where changes need to be made and how the healthcare system needs to ensure cultural safety for all Indigenous people and all people.
Another recommendation, an apology from the BC government.
I want to make an unequivocal apology as the Minister of Health to those who have experienced racism in accessing healthcare services in British Columbia now and in the past.
Time will tell whether that apology has any actual teeth behind it.
I hope very much that this will be more than just one day today, that this will begin a process of significant change in British Columbia.
The health minister says BC will now work in partnership with Indigenous groups to implement all 24 of the report recommendations as quickly as possible. In Vancouver, Travis Prasad, City News.